for everyone who is joining, please feel welcome. And as we wait for other people to join, kindly, I just want to ask us to do a small exercise. So just type in the chat with an emoji how you're feeling this evening. So it could be you're feeling amazing. You can just share some fire emojis. If you're feeling sad, it's okay. You can just share some sad emojis. So please, kindly, guys, I just ask you to just utilize your most favorite emoji and type in the chat. Just drop it. A fire emoji, a happy emoji, however you're feeling. So I'll start. Just guys feel free to type in the chat how you're feeling. Just use an emoji. Cool. Okay. Can see some people are feeling like nice, nice. And welcome everyone. Please type in the chat with an emoji how you're feeling. We want to see the vibe that we have in the room before we start. Guys, only two people have typed. Please, please, let's collaborate. Just don't let me be alone on this one. Okay, some fire emojis, some happy-go-lucky emojis. Please, guys, I can
Don't
see most.
worry, Shiro. We are together. We are together on this.
Okay, okay. Ah, good. I can see. Can see my hater is feeling some mixed feelings. Okay, Eric, thank you for that. Uh-huh. I can see we have Beatrice is feeling all nice and sending us some love. Kavulani is sending us some kisses. Thank you so much. That's cute. Elsie is feeling nice. I can see that. Uh-huh. Let's see. Okay. Ariba. Aha. I can see Ariba is feeling like I think some bit of curiosity. I normally like see this emoji pop up when you're a bit curious, like when you're typing in the chat. Okay, let me get some three more, please, guys. Some three more. And then we can start. Again, welcome to this webinar. We were just giving people some buffer time. As Kenyans, we all know how we are not good at keeping time. Yeah, so I just want some three emojis. And yeah, okay. Marilyn, thank you. Feeling awesome. All right. Two more, guys. Two more emojis. Two more emojis before I hand over the mic. Hey, two more emojis, please, guys. Guys, please, please, please. Come on. If you're going to start like this, hey? I know guys are tired. It's been a long day at work. But yeah, just type how you're feeling. Sule, thank you. Hugs. So one more emoji before I send over the mic. One more emoji from somebody. Anybody? Going once, going twice. Ah, Kavulani, thank you so much. Okay, thank you for that, for sharing how you're feeling. So I just hand over the mic to Ahito at this point, to Elsie, sorry. And my name is Wanjiro. Thank you so much for joining. Welcome to our webinar today, and I hope we learn together. We enjoy the session. So over to you, Elsie. And please, guys, turn on your camera if you can. We just want to see your cute faces and have an engaging session. Thank you. Elsie, over to you and Wahito.
Thank you so much, Wanjiro. Good evening, everyone. And I'm just so excited because this is the inaugural convening of Echoes of Hope, coping with endometriosis, endometriosis hidden burden. And the two organizations that are hosting this are Gutoria and Lost State of Mind. And before I call Lydia and Suleiman to give a word and just talk about where the background of this event and where it was birthed, I would like to introduce myself. My name is Elsie Wandera, and I have the honor of serving as the co-chair of the World Endometriosis Organizations as the first African taking on this global leadership. And I'm also the founder of the Endometriosis Foundation of Kenya. So, in a nutshell, I'm a patient advocate and I'm also an emerging researcher. So, something exciting that I did this past May is that I got to present my research poster at the World Congress on Endometriosis in Sydney, where my goal was to ensure that Kenya's voice, and which is our collective voice, was represented on the global stage by a patient led organization. And this is for the very first time. So those are the things that are exciting, and I'm hoping that you are as eager and as hopeful as I am to hear and to participate in this conversation. So before I tell you a little bit about myself, I think it would make sense for us to set the stage. And for that, I would like to welcome Lydia Wahito and Suleiman, who will talk about Echoes of Hope and what they're trying to do through this incredible platform. Karibuni, Lydia and Suleiman.
Uh, Thank you so much, Elsie, for the very good introduction, and welcome everyone to the webinar. So this project is called Echoes of Hope. It's a multidisciplinary project that we are just starting off. Multidisciplinary in the sense that we are using different forms of art to raise awareness on endometriosis, as well as hopefully drive policy change and also connect patients to doctors, as well as give them relief. So that's what this project is about. I'm a photographer by profession, so we do hope to use photography. And Sule and Vic, who will talk a bit about dance, they run the organization called Lost State of Mind that uses dance to address mental health issues. So since we are creatives, we decided to use the tools that we have on hand to just highlight to a lot more people what endometriosis is. As well an endo warrior, and that's why I was so passionate about talking about endometriosis and just raising awareness and hopefully making it better for other patients. So I'll ask Sule to continue and just explain a bit more about lost state of mind.
Hello, everyone. I'm really glad to be here today. My name is Suleiman Maningi, one of the co-founders of Lost State of Mind.
And I am Vincent Owoko, also known as Vic, one of the co-founders of Lost State of Mind.
So basically at Lost, what we normally do, we normally use dance and art to create awareness on mental health and also factor in other society issues that normally most people don't talk about. So we try to use what we know best, our art, to be able to create awareness. We always feel that art can be able to speak the language most people cannot be able to speak out in through words. So art enables us to be able to speak those things that are not spoken by words. So this project, we met with Lydia sometime back this year in a different project. And in the basis of us just talking and seeing how we can work together, she told us the story and we were really moved about the story, and we said, let's work together, let's create awareness outside there, let's use dance to be able to use this and to empower more people outside there. So we brought dance and photography to be able to create awareness on endometriosis, and it's something that we hope it will be able to change and give people hope outside there.
Yeah, it actually started when we were having tea. It was the small talk you guys sometimes you always have. Yeah, the small talks. That is how all this started.
Yeah. A good reminder.
Yeah, and we hope we're gonna be create more awareness and we're gonna be able to reach out to many people about this story. And yes, we're looking forward to this journey. Back to you.
Back to you, Elsie.
Thank you, lady and gentlemen. So I'm excited. I love dancing, by the way. So, and I hope that you all love dancing. So I think for me, the exciting part is one that I get to wear two hats today. So I'm moderating this session. But in addition, I'm also a woman who has lived with this disease in my body and for years. And I've experienced the symptoms as soon as I started my menses and, lived with years of misdiagnosis, the debilitating pain, treated, having gone through repeated surgeries. I've had like 4 surgeries and of course struggled with fertility and ultimately, losing both my ovaries. And again, my story, or rather my journey, didn't end there, right? So when you think you've finished, right? So I had my fourth surgery and I was excited. I was like, oh my God, relief. Um, but it got me into a new phase, which is called perimenopause, and I'm now on hormone replacement therapy. But enough about me. I think what we don't want to do today is we don't want to spend too much time on me because today this is so unique for me. I am coming in again as a moderator. So I am just excited because we're going to be talking about the mental burden of this disease and it's such a hidden burden. I don't think you can see the challenges and the scars that a lot of women are struggling and undergoing. And so for me, I think it's about bringing the lived experience of Lydia, who is going to come back on stage shortly. And she'll share her perspective as a woman who's, fought for her voice, for answers and eventually for healing. And I know that many of you are here and you've probably fought similar battles or you know someone. You've been in doctors' rooms where you've been dismissed, in the offices where your careers are being compromised and all of that. And I think the biggest battle that all of us must, I mean, like, would, I think, share is the one that is happening in our mind. And so tonight we want to continue to break the silence, right? Because, and Lydia met me through my work around the advocacy that I've been doing. And so today we are going to name the emotional toll that comes with this condition, the anxiety, the depression, the real fear, the grief, and even sometimes I think the identity loss. And so we're going to move from that to hopefully reclaiming hope, right? And creating community and also building our mental resilience as we're on this journey to heal. So this is not a webinar. I mean, in as much as it says it's a webinar, it's a safe space. So we encourage all of you guys to share your questions, your comments in the chat. Wanjiro is at hand and she'll be looking out for them. And at a later segment and at a later part of this session, we will get to hear from you guys and also hopefully answer some of your questions. So to ground us in this lived reality, I'd like to invite Lydia, who will begin with her personal story. And Lydia is a very powerful voice. I think for me, when I heard her story, I was just baffled. And I want to thank you once again for your courage because this is not easy to share. No one, it's never easy, right? So Lydia, welcome back on stage. Why don't you just tell us your story in your own words? We've not scripted anything. I'm sure this is her first time telling it on such a stage. And so let's give her some love emojis and some claps as she comes back on stage. Karibu.
Thank you so much, Elsie, for the kind words.
through the introduction. I think before I even start off on my story, I would like to share a little bit about how I met Elsie. I'm so sure she doesn't remember. Um, in 2016, I was just starting my photography journey, and my first project was an endo project. At the time, I hadn't even gotten my diagnosis. I didn't know I had endo, but I was in the Endometriosis Foundation group on Facebook. So I did the project with a few friends, my sister, my husband, and because I was just sharing the experience I was feeling. I just was relating so much to what the other endo warriors were going through. That's why I was in the group even before I got the diagnosis. So in 2016, doing my first photography project, I shared the photos online. Then I DM'd Elsie. I DM'd Elsie and I asked her, I did this project. Could you kindly share this project in the Endometriosis Foundation group? And and she did. The weird thing is she didn't even ask me anything. She didn't say no. She didn't ask. It's such a funny thing. I remembered that, and I'm so sure she can't remember. But yeah, that was a long time ago. And I think every time I've encountered Elsie, she's been so gracious to me, even when she doesn't really know me that well, or she doesn't quite know me up until recently. So thank you so much for that. So just to begin sharing my experience, I'm Lydia Waheto, and I'm an overcomer. I can say I'm an overcomer because I have overcome, first of all, abdominal TB. I remember it was our 1 year anniversary after our wedding. I contracted abdominal TB and I was on treatment for a whole year for that. I'm an overcomer because I'll call it, I've overcome endometriosis. I was diagnosed in 2023. And I went through surgery, open surgery, to just remove the endometriomas that I had. And I'm also grateful to say that through that surgery, I've seen a big change in my life. And I can also still say I'm an overcomer because having experienced infertility for 10 years and post my surgery, being able to conceive and get a baby, I think like that qualifies for me to actually be proud of the journey that I've been through and just continue to encourage myself and say for sure I've overcome. But I can also say that the experience has not been easy. Before I was diagnosed with endometriosis, I had lived with pain for roughly 12 years. And anybody who has endometriosis or has heard about endometriosis knows the level of debilitating pain that you experience. So my last year of campus, I remember I'd just come from church. I went to my room and I was curled up and I was wondering, why are these cramps so bad? And all through the years up to when I was diagnosed, the pain just kept increasing and I could feel even the symptoms increasing. And at the time, I didn't even know what was going on. At the time after I got TB, I thought, okay, maybe these are the long-lasting effects of abdominal TB. At some point, because when I've done so many scans in my lifetime, and there were fibroids that were seen. And I think, okay, so probably it's the fibroids that are causing this, the issues. So even as I was going for surgery, I knew I was going for a myomectomy to remove fibroids, only to go for surgery and be diagnosed with stage 4 endometriosis and adenomyosis. So though I experienced a lot of physical challenges, be it the fatigue, the mental fog. I don't know whether other people have experienced, but I used to have a lot of mental fog. There are also the mental challenges that I experienced just coming from the physical challenges that I had. So you'd find that a lot of the time I had insomnia. I'd wake up in the middle of the night because, of course, you can't sleep because of the pain. The pain is too bad. So I'd wake up, go warm some water, put it in my hot water bottle, take painkillers, and sit on the couch to just wait it out before I could go back to bed. And through those sessions where I was just lying on the couch, maybe it's 3 a.m. in the morning, you can't sleep, you have that extremely hot water bottle pressed against your back. All I could think about was, is this worth it? Because if you have pain for at least 7 to 10 days in a month, and it's extreme pain, you're taking painkillers are not working, you get to ask yourself, you get to a point where I got to a point where I was asking myself, is this really worth it? What's the point of living such a life? So it was quite hectic for me. And there are also other things that I got to experience through that process. I remember I'd feel like I was such a downer when interacting with my family, with friends. You'd be having a good conversation, you're having fun, suddenly the pain starts. And all of a sudden, you can't be the happy-go-lucky person that they were hoping you could be. So how you show up also in the world changes, and that also affects your relationship, and it also can put a strain on your relationship. What I'm so grateful for is a loving and caring husband who was able to support me through that entire period without making me feel like I'm a burden. I'm grateful for a wonderful support system, my sisters, my aunts, who were able to just be patient with me and accept me. And even when the pain would start and they'd see the shift in my mood, they'd immediately ask me, the pain has started. And so they would really quite understand. So I'm grateful for that. But the challenge in itself was there, and you'd really struggle with, am I being a burden to the people who love you? I'm not showing up as the best version of myself, because you really can't. Yeah, so those are just some of the challenges I was experiencing. I remember through this journey, it's quite an expensive journey because I used to exhaust my insurance. So I'd end up spending my cash to just pay for doctor's visits. Even when leading up to the surgery, our insurance had said, we are not going to cover the surgery. So there's also this mental strain where you're thinking, am I only working for paying for medicine, paying for doctors' bills? And also the challenge of, am I making my family move backwards, because a lot of our money is going to all these, and it's not cheap. I know for a lot of people who are endo warriors, they know how expensive it is to just be on medication. The consultants that we see, because they're specialized, it costs quite a bit. Yeah, and for the surgery, my doctor was like, it will cost around 550,000, and we had to take a whole year to just save up for that surgery, because we knew insurance wasn't going to pay for it. So I was so discouraged at that point when I knew we needed to save up for a whole year, I was extremely down, and I remember being so discouraged, and just the people around me just encouraging me and walking me through that. And even as time for the surgery grew closer, one of the things I was hoping for, despite a previous surgery, I was hoping for a laparoscopy. So I was really praying to God, please God, don't let me have another open surgery. I've had one open surgery because my diagnosis for abdominal TB had to happen through open surgery. So I was just like, God, please don't let this be another open surgery. Unfortunately, the endometriosis that were in my body were too big. So the doctor was recommended it has to be open surgery. There's no way of removing a 10 centimeter endometrioma. And at that time, we thought it was a fibroid, but it was an endometrioma. There's no way of removing a 10 centimeter endometrioma through a laparoscopy. And I think at that point, I was really, really crushed. I remember I really held my tears during that doctor's visit. And I went and cried Talilia Mbele because I went outside and there were so many people and I was like, I can't even cry here. So when I got to the office, I just let down all the tears and I was just like, God, this is so unfair. I think I've been trying to figure out what is going on. But I can also say that God has been gracious to me that through that surgery, despite me uh, experiencing all that, I was able to find a lot of relief, not some level of relief, but a lot of relief. I'm so grateful to my doctor, Dr. Owende, and my anesthetist that post my surgery, I was not in pain and I have not been in pain since. And shortly after my surgery, I was able to conceive after um, dealing with fertility issues for 10 years. So, and that is from day one of my, since getting married up to our 10-year anniversary. That's, I think, a month after our 10-year anniversary. That's when I delivered our son. And I'm so grateful for my husband who was patient enough with me, who held me down all through this period. I can't say it was an easy journey for him either. And I know for other caregivers, it's not easy for them as well. So thank you to all the caregivers who hold down the people who experience endometriosis, and to all the people who have endometriosis. I just want to encourage you. I know how hard the journey is, and I know how exhausting even taking medication is. For me, it had reached a point I was like, I'd tried Arrowet, and I was like, Arrowet, it's okay, it's helped me a bit, but I'm not quite there. The painkillers, you take painkillers after 2 hours, you're still in a lot of pain. But I just want to encourage you that your life can get better, and do not be discouraged. I know it's a difficult journey, but you can overcome, and that's the whole purpose of this project. So keep walking, be encouraged. You have a whole community of other endo warriors who will walk this journey with you. So you are not alone. And thank you for listening to my story. So over back to you, Elsie.
Wow. I mean, I've taken notes
Mm.
because I'm like, first and foremost, I would have cried in that hospital, in that doctor's office. Like there's no, and you know, like that's what we like have normalized. Like I don't know, like we're imagining we are, because doctors, I think, treat us like, you know, just like they see us not as a whole person, right? I think they just see the disease, and sometimes they're detached from the other, you know, the profound mental implications that the disease and those kinds of news have on us, right?
Yeah.
So I think just well done. I think on sharing, just that it takes profound courage. And I think for me, the things that again I've noted and which I think we can talk about later, is that, first, you've lived with pain for 12 years. So it's like there's a
Mm.
normalization of pain by
Mm.
society, right?
Yeah.
We know that there is delays in diagnosis for people who have been diagnosed with endometriosis. It takes between 7 to 10 years. You know, we think that pain is normal, and so we don't even know when to seek medical assistance.
Mm.
And that, I'll call it like that self-talk that just takes you down into like that rabbit hole that is never ending. It's like, I'm a burden, I can't ask for help. Um, and just the cost of healthcare. I don't even want to bring that up because all of us on this call, I'm sure, know how expensive healthcare is generally, even right now, the state of our country. But just for me, I think it's just it's just an incredible story and a miracle, like your 10th anniversary, just having conceived and give. I mean, that's just like an amazing story, and I can't wait for the question and answers because I'm sure there are people who have some interesting questions. So I want to take us now to Elizabeth, and Elizabeth, you can now come on screen because I'm now going to put you on the spot because and what we decided to do is not, just I mean, she could give a lecture, right? She could choose to give a lecture, she could choose to use slides, but again, this is a very relaxed environment that we want to create. And so we just want to ask Liz a few questions that can also just set the stage. But I think there are some people who might be on here who might not know what endometriosis is, right? It's a chronic inflammatory disease where tissue similar to the lining of the uterus grows outside of the uterus. So you can find it on organs like the ovaries, the bladder, the bowels, and even the diaphragm. Like I think most of you might remember Jambi Koikai, that's what she had. And it causes just severe pain and can lead to some organ damage, leads also to infertility. I think 1 in 3 women who suffer with endometriosis also might face that challenge. And just like this whole fatigue that is just never ending that you can't even explain. But I think the one thing that we are very cognizant of is because of the stigma and the misdiagnosis around this condition, it takes, like the number of years, 7 to 10 years, like I said earlier, before anyone receives a proper diagnosis. And so if you know if you're in a group of 10 women, one of them is actually suffering with endometriosis. So we have moved away from referring to endometriosis as a reproductive condition. It is actually a whole body disease. And like I mentioned earlier, we know the burden that it comes with from a mental health perspective, and that's what we're here to really talk about. So Liz, I'd like for you to just help us unpack the emotional, the psychological, and probably even spiritual impact of living with endometriosis. I'll start with the first question because we know that it's quite a hidden burden, and there are not many people who know how to cope with it. So tell us, people, think endometriosis is just physical pain, right? So I'm cramping, I'm in pain, I can show up, but there is this invisible layer that many don't talk about. And so, from your perspective as a psychologist, and you can also introduce yourself because I don't think we've given you that opportunity. What are some of the most common struggles, emotionally and mentally, that many of the endo warriors face? Karibu, Liz.
Thank you, Elsie. My name is Elizabeth Havulani. I'll be your psychologist for today. And I'm glad we have this platform because one thing I believe is that when we create awareness, we reduce illnesses, we reduce diagnosis, and we have people manage situations better. And there's one question you asked that most people think that for endometriosis, you only deal with the physical aspect. And that's a true lie. There's something like that. One thing with endometriosis, the process of just being diagnosed, one itself, it's just a big whole issue because you might be experiencing pain and you feel like maybe it's period cramps, or maybe you feel it's just a back pain, and then someone comes and tells you a new name, oh, you have endometriosis, and you've never heard of that. And I think that's why we have this platform today, so that even that person who is not aware of what endometriosis is, because just the way our Elsie shared is that, yeah, you have your womb, but there's some tissue lining in the womb that grows outside the womb. So anytime, when we are ovulating, if an egg is not fertilized, then the walls of the womb have to tear off. But for the endometriosis, the walls of the womb are tearing off, but the blood is not coming out. So you can imagine, it's like if you have endometrium cells, let's say in your back, that means you're going to experience period cramps in your back, just the way you usually experience them in your lower tummy. And to be honest, sometimes you even get the endometrium cells in your skin. That's how it is. And I love the fact that Elsie shared that it is a whole body situation. One, being confused is one of the things after you've been told you have this diagnosis. Feel so confused because maybe you've not heard of it any time. And that's why we are here. You never know. Maybe I might be the next person who's diagnosed with endometriosis. But the fact that I have this knowledge, it won't be as difficult for me as compared to someone who never knew. Another thing, so we're looking at it in terms of short term and long term. Short term, you'll be confused once you're told about your diagnosis. The second one, you'll be anxious because this is something new, this is something new. You've never been told about it. No one has ever shared. So it's something you have to struggle with on your own for a long period of time. So that makes it even more difficult for you to deal with it. And also you realize that for endometriosis, apart from the physical aspect, I mean, there's the psychological aspect where there's stigma from the society. The moment you share with someone you're experiencing pain, let's even not move straight to endometriosis. Let's just start with period pains. Sometimes you're just trying to explain to someone how you're experiencing period pains, and they're like, no, you're pretending, you don't need to take medication, you'll be messing up with your body, as though they understand how you're feeling, but the pain is too much. So imagine for endometriosis, it's like 2 times, I don't even know if I should say 2 times or 3 times or 10 times the periods. And you just try to explain to someone, I'm in pain, and they feel like you're pretending, or you don't want to go to work, you don't want to do this and this and this. And then you also take it to yourself mentally. You start self-stigmatizing yourself. You feel like, why am I even feeling this pain? Why am I not going to work because of this pain? But the thing is, the pain you're experiencing is too much pain that it cannot be ignored. It cannot be ignored. And sometimes you even fear the stigmatization. You go to the doctor, they've told you have endometriosis for the first time. Maybe it's in stage 1. And you're like, how am I going to share this with someone else? How am I going to tell them? How am I going to explain all these things? So you fear being stigmatized by other people. Those are just some of the short-term things that you'll observe. Sometimes you get no support from the people around you. That's also a stressor. So these short things will make you feel overwhelmed, will make you feel stressed. And another thing we need to understand is that there are also long-term mental health conditions that occur as a result of endometriosis. especially when you're beginning your treatment. Remember, for the endometrium cells to stop growing, estrogen is what helps in the development of endometrial cells. So you can either go for the surgery, you can either get medication, contraceptives, and we can all say, even if we have women right now here, not all contraceptives work well for us. You might be using in the normal lifestyle, you try using a certain contraceptive, it's not working well for you. Then you go to a physician, they tell you you have to use an contraceptives. For 3 months continuously, you have to take one pill every day, every day, every day. And you're like, oh, Jesus, what is that? Or sometimes you use some contraceptives and they don't work according to how your body needs to work. And remember, these contraceptives are there to reduce estrogen in your body. And estrogen is a balancing hormone. It is what will make you feel happy, it's what will make you feel sad, it's what will make you feel fulfilled. Now, if you have hormones that are in balance in your body, then you're more likely to receive some conditions like moodiness because the estrogen levels are so low. And when you experience a mood like sadness for a period of time, you're at a risk of depression. When you experience fear, you're at a risk of anxiety. When you experience mixed emotions, fear, happiness, and sadness, you're at a risk of bipolar. And sometimes it even leads to loss and grief. Because I think Elsie shared with us that there's a period of time where she had to um, get her ovaries, a surgery through her ovaries removed. That's not something easy. That's not easy. It takes a toll on someone. One can experience loss and grief as a result. Just having one part of your body being removed, it's not an easy thing. Even those surgeries are not easy. So it comes along with so many things. One, the short-term psychological symptoms that if they are not dealt with, they can lead to mental health conditions. And these mental health conditions can be like anxiety, bipolar, depression, loss and grief. But one thing we need to know that we are here so that we can learn how we can deal with these mental health conditions and to normalize that sometimes you can experience sadness even at that time when you've been diagnosed, you're going through pain, and it's okay. Feel the sadness, express yourself, allow yourself to feel it, and things will be okay. So I think I've been able to summarize that question.
Yeah. And I think it's a perfect segue because, I've had girls, in the WhatsApp groups or in the Facebook groups even just ask questions around when is the right time to tell my partner that I have endometriosis. So for when, so there are many women who have been diagnosed with this disease whose identity has been affected, whether as a woman, like myself, I know that affected me, as a partner, that affected me because I used to think, one day I'll start a family. And even as a professional, how does endometriosis impact someone's sense of identity or self-worth?
Yeah, that's a very good question. When you talk about identity, it encompasses a lot of factors, both internal and external. Internal can be our physical appearance, can be who we are, like how we are created physically, the psychologically, how we feel about ourselves. And the external, like our professions, can identify us. For example, today when I've been asked to introduce myself as a counseling psychologist. So one thing, when it comes to families, your identity as a woman. As I was sharing with you, most times or sometimes you'll find that anyone diagnosed with endometriosis, they have to go through a hormonal therapy to help in just regulating and managing the pain. And this hormonal therapy, there's a hormone that is very, very important that helps in growing of our boobs, that helps in making our voice soft, that helps in ensuring that we have love handles, that we have hips, that we have everything that is needed. And I know some people really love their hips and everything. Now, the moment this hormone is removed, then things change. You start to look more masculine. For some people, not everyone. Your voice can become hoarse, and you don't feel like yourself anymore. And sometimes you can even grow beards, even though there's some of us who just grow beards. I think men, if we have men around here, which I would love them to be here, they should normalize the fact that women can have beards. It's very normal. So you find that as a result of the treatment process, you begin losing yourself because you believe as a woman, I need to look in a certain way. But one thing I want you to know is that the experiences you're having as an endo hero are different from who you are. All the physical symptoms you're experiencing are totally different from who you are. They should not define you. Because you find that sometimes maybe I had a very good bus, but all of a sudden it's just flat. What's happening? Such changes. So you find that as a woman, physically, it affects you. In your profession, sometimes you really need time to rest. Sometimes you need some time off to go see the doctor. You are scheduled for a surgery a certain day. This person doesn't understand that the surgery is supposed to happen in such a day. And they feel like you're joking around with work. And this is a matter of life and death. So you find sometimes you end up losing your job. And that's how your identity is lost. How am I going to call myself a counseling psychologist if I'm not practicing? You lose your job for the sake of your well being. Sometimes, even in our marital relationships, you can even lose a partner because maybe they have so much expectations from you, and because of that it takes a toll on you. It can literally lead to loss of identity. But one thing I want us to understand as Indo heroes, or if you have a sister or a mother or a friend, is that through this process, if you do understand, you can find meaning and create a new identity through this, so that you don't lose the goodness in you. As I shared, the experiences, the symptoms do not define you. You're totally a great human being who's created to just build and bloom in this world. Yes, so that's what I would say, Elsie, for that.
I love it. And I'm learning so much from you. I think even just meeting you earlier, I think, that language of just learning to identify the symptoms, the psychological symptoms before they turn into mental disorders. I think that for me was like the biggest thing that like I took away from the conversation that we started having with you. And I couldn't like help but imagine, there are so many women who are out there who are labeled as dramatic. Immediately you say that one, you've started going through your periods, you're going through pain, you're dramatic, you're faking it, you're trying to hepa jobo or run away from responsibilities. And in some marital situations, I think people have been told, you have another partner because sex is painful, right?
Yeah.
Now, there's this pressure that comes as a result of that, because we feel as women that we need to appear strong. And right, society has trained us from a very young age to wear the crown, like the crown of pain, like
Yeah.
so graciously, and like we should actually appear strong even in those times when you should actually be seeking help. So tell us, how does this appearing strong affect our mental health, and what's the cost of actually also suffering in silence? Because the opposite is actually true. There are people who might not want to come out and talk about what they're really going through.
Yeah. Thank you for sharing that. I think the fact that there are people who are going through a lot of pain but they're not sharing about it, that's what leads to even being diagnosed with mental health conditions. And even it leads to situations whereby people have to isolate themselves. Because remember, when you share, you're able to communicate and people are able to understand what you are going through. And one, even if they do not understand, at least you shared. Because one thing we need to understand as human beings is that you can convey a message and it won't turn out as you expected it to turn out. But the fact that you did convey it is really important. If you choose to be silent or you walk in this journey alone, in distress, it can take a toll on you. One, you might be at a risk of getting the mental health conditions as I shared. Depression thrives in isolation. Anxiety thrives in fear. If fear talking about it, anxiety is always looking at you. Wow, I got a friend. Bipolar is thriving in mixed emotions that are not shared. And one thing also, for example, if we get such a team, it's giving us the strength to know, oh, I am not alone. And I believe we should even make it more physical to a point that people can show up and just talk and share how they're feeling, how their journey has been. Let's normalize this because no one chooses to have endometriosis. In fact, a research has been done to just understand the cause. It hasn't been found. The cause hasn't been found. Only some few theories here and there. So the fact that we are in this position, we can choose to make it fun in our recovery, make it better for ourselves. Silence will lead to isolation. Silence will lead to mental health conditions. Silence will lead to self-stigma. Silence will lead to societal stigma. So you should feel very comfortable talking about it around people, around the society, so that someone who's seated there and they don't even understand that, oh, I think you talked about something that I'm also going through, and you're like, yay, we're together in this, we can move. And that would really, really help a lot. Yeah.
I mean, like the wait, isolation. What did you say? Isolation thrives in depression thrives in isolation.
Yes.
I mean, guys, let's close this webinar. We're done. That's like the biggest takeaway for me. What? I mean, like you guys, are you hearing? Are you learning like me? I mean, okay, let
Elsie,
me.
can I just jump in
Yes, please.
before you continue? I think I've also captured quite a bit from what Elizabeth has just said. I can share a bit more from experience, maybe not from a psychologist perspective, but because I have interacted with friends and colleagues who have also been diagnosed with endometriosis. I think a lot of people struggle with acceptance of just the diagnosis from the get-go. And there's so much stigma to just saying I have endometriosis and I'm an endo warrior. And maybe what I can advise other endo warriors like me is if you're struggling to talk to many people, start with one. Just start with one person you trust. It can be a family member, it can be a fellow endo warrior, because for me, what I felt confident in doing is talking to a friend who I knew would understand because she's also been diagnosed with endometriosis. And I found that colleagues also reach out to me because they know I have endometriosis and they can confide in me until they're able to probably talk to more people. So just find the courage to talk to one person and then work through it as you go along. It will help you along the way, just as Liz has said.
I love it. And again, perfect segue into, coping mechanisms. I mean, we know there are some people who've resorted to unhealthy coping mechanisms. Liz, I'd like for you to just share with us, right? So what are some healthy strategies? So instead of, just being overcome by our emotions and our anxiety, what can we do differently so that we're coping in a healthier way?
Wow, thank you for asking that. One, I think acceptance really helps a lot. Accepting yourself for who you are transforming into. Because I feel like being diagnosed with endometriosis, it's like a life transformation. You're starting a new life. You're starting a life in a new slate, because you never know what the doctor is gonna tell you the next time. You never like you think you're doing this, all of a sudden this comes up, like you. In fact, you're meeting people and you're telling them, hey, yo, guys, you should know that I'm one person who's always ready for surprises, because you will always get something here and there. So accepting what you're going through is something that would really, really help a lot. And then another thing, understand yourself. Self-awareness is very important. Understand yourself. Which times do I feel like this? At what stage am I in? Is it stage one? Is it stage two? Is it stage three? Is it stage four? Once you're aware, you're able to manage the situation better. You're able to know when I need this particular support and when I need this particular support. For the psychological symptoms, understand that whenever you're diagnosed with endometriosis, you can experience psychological symptoms, but they do not mean that you're depressed. For you to be diagnosed with depression, you have to see a psychiatrist, you have to see a psychologist who's going to do assessments and diagnose you, depending on the period that you've been experiencing the symptom and how they affect your normal functionality. So, what is making you experience psychological symptom is because there is a hormone that is necessary in balancing hormones that will help with your psychological well-being, and it is absent or it is minimal because of the treatment that you are getting. So it is very normal for you to experience those psychological symptoms. You'll feel moody sometimes. You'll feel irritable sometimes. For heaven's sake, who lives a happy life? Who just wakes up laughing the whole day? It doesn't happen that way. There are days you just feel low and it's okay. Let's normalize feeling sad and working through the emotions until we are okay. But one thing you need to realize, when this sadness is too much, when it's affecting your normal functionality, you can't take a bath, you can't cook, you cannot see your friends, you don't want anyone around you, you're having negative thoughts, then for that you need to understand that you can see a therapist. And also you can visit Lost. Lost, we do so many good things that really help with your mental well-being. Dance therapy will be moving around with you. You can do art therapy, you can find a therapist who you can share with, and they'll be able to walk through this journey with you. Just have a support system. And I think the support system starts with us. We can now choose even to create a group therapy session. Just meet and talk about what we are going through. You share out today, this is how it's feeling. Oh my God, the pain was that. You usually say, rate your pain from 1 to 9. Where was it? Someone says, mine this week was at 3. Someone else says this week it was at 9. Someone else 10. And receiving hugs from each and every one of us. That can be very, very helpful. So one, let's work through this journey of acceptance. And even if you're in denial, I really want you to know that it's okay when it comes to dealing with change, or I would say, because any diagnosis that we get in life, it's usually like, I won't say there's someone who is even diagnosed with malaria and they're like, wow, think you got malaria. Not really. It's usually a hard time through it. So you find sometimes you might be in denial, sometimes you might be through anger, sometimes you might be bargaining to God and telling him, oh God, please change, or give me one more chance, or do this, just trying to see if things can change. Sometimes you can be in depression. Sometimes you can accept. So just learn, even in your denial, please understand that it's okay for a human being to be in denial. It's not bad. But understand, try and move to the journey of acceptance through support. Be self-aware of who you are. Try and seek therapy. If talk therapy is not working well for you, seek dance therapy, seek art therapy, seek music therapy, seek nature therapy, where you just go and walk around the forest and then come back. It would really be helpful, among other things. And be the change you want to see. So if you want people, if we want people to like stop stigmatizing endo heroes, then we have to stop stigmatizing ourselves, because we need to be the change that we need to see. Of course, it's not an easy journey, but if we show ourselves self-love, if we love ourselves, if we show ourselves care, if we embrace this journey, it's going to be very helpful for us. Yeah.
I mean, I can completely relate with that, and thank you, because I feel like those are, again, the little nuggets that we can walk out of here with, because it's sounding hopeful. And I think Lydia, myself, we're here. We are faces of women who have gone through it, right, for years. And I can testify that, I mean, in 2020, I think it was, I was diagnosed with depression. And for me, it took a minute before I could recognize what my symptoms actually were. And it was my gynecologist, who then told me, I don't think you're in a good place, right? So he immediately recommended that I see a psychiatrist and a psychologist, and that's when I got on medication. So then I learned that from the psychologist that this was actually grief, what I was going through, losing my ovaries, the ability to conceive or to ever become a mother. I mean, there were just so many things that were so layered that needed to be unpacked. The years of pain and suffering, the multiple surgeries, that's not normal. And that, I think, for me, is a thing, again, like we're all encouraging each other here, and we're saying, imagine, seek help, speak up. I don't know who will take away from you or from your identity or who you are when you just say you're not okay. So I think the other thing that we need to learn is how to say no, like turn down those engagements, those social engagements. If it's going to be too much for you this weekend and you can't show up, it's okay. Imagine the world is not going to stop, or the price of cocoa in Ghana is not going to change because you're not going to show up. Imagine, I think that's my thought. But I think because we have, we had set aside some time and we wanted to engage with the audience. I know that there have been some questions that have been coming through. I hope, Wanjiro, you've been keeping an eye. Liz, I mean, thank you. This conversation when it comes to endometriosis, we really we can't cap it. We can never finish talking about it. We can never stop finishing. I mean, like, we can never stop talking about, or we can never have enough time to really, really dive deep. But I love that these sessions have started, and I'm glad that, Lydia, you invited me into this space. So again, I really, really want to thank all of you. So, and I know many people have been listening, and I hope that we've validated, in one way or the other. I hope that you're feeling seen, right? In probably, and this space is finally feeling like, oh my God, someone is actually seeing, someone is speaking my language. And so I want to bring back Lydia on the stage, even though she brought herself back again. And, I'd like to now open the floors for, the floor for your questions. And depending on how many they are, we can continue answering, a few of what we see, and hopefully even curate some content around the questions, and the comments that you're sharing with us, so that we can, again, with awareness comes acceptance. another line, guys. I hope you are taking notes, by the way. I think we needed a marking scheme after this. Like we needed like the quotable quotes, the tweetable tweets. So yeah, so I think I'd like to invite Wanjiro to help me moderate the Q&A, and then I'll direct them to either Lydia or Liz.
Okay,
And
thank
if you don't mind, also just for the questions, like if people are asking a question, if you want to ask on mic, please come forward and even switch on your camera so that we see you.
Yeah, thank you for that. Thank you so much, Elsie, for moderating the session. And thank you, Elizabeth, and I know Hato for sharing your story. So I'm seeing on the chat we have only one question from Deborah, but before we can get more questions rolling in, please feel free to like shoot your hand up. If you're not comfortable turning on your video, you can just unmute and ask your question. Alternatively, it's also good if you can be able to turn on your video camera. And the other option would be also to type in the chat. We will make sure that we answer all the questions. Yeah, so from Deborah, I can see she's asking, at what point do you recommend surgery? And is there some kind of help to find out at what stage we are in? So I think this is a question that both Waheto and Elsie can answer, and even Elizabeth can share some insight, if any. So we can start with Waheto.
Thank you, Wanjiro, for the question. To be honest, I think your doctor would be the best suited in providing guidance on when it's best to go for surgery. But I can share from my experience, and a lot of the times what I do know is when the doctors have exhausted all possible means of trying to manage the disease and there's no other option, that's when probably they'll recommend surgery. In my case, I had already had the disease for 12 years. I'm not saying anybody should wait that long. We are hoping that the process of diagnosis takes a lot shorter periods of time. But a lot of the times, the doctor will go through various therapies. I think that's the best word I can use, to just try and see whether it is manageable. But if the condition is not improving, they'll probably recommend surgery. But also one of the things I learned through just seeing different doctors is advocating for yourself. I realized I need to be able to advocate to myself because sometimes doctors may not fully understand what you're going through. So by the time I had my surgery, I had switched the doctor I'd seen for 5 years, and I was now seeing a new doctor who was really listening to my history and all that. And I went in straight away and told them, I am done. I'm not waiting. I want surgery. I think that's why also that 1 year waiting period for us to just get enough cash was a big hit for me. But also understanding yourself and understanding you're at that point where no, this thing I can't continue like this. I've tried this and it hasn't worked. We've tried this, it hasn't worked. So also, even as your doctor recommends the next step, also it's important to advocate for yourself.
Yeah. Thanks, Lydia. And I love that because I think that's the first place, right? So I think turn into your biggest advocate, right? So as you even experience the symptoms, one thing I'd encourage you to do is document, right? So, and that's the way that you can actually have very good conversation with the doctor who will then understand what you're going through even deeper, because you will guide them based on your symptoms, But I think there's another question which you're asked, and like your pain severity, that's another thing. They look at it, they look at the quality of your life. They'll even ask you questions around, and you should also have like, what are your fertility goals, right? So are you planning to have children in the future? Because we know that the minute again you think of surgery, whenever surgery is like whenever that conversation is opened, it can impact some of those goals that you have. So, and I'm not saying that you can't have children. I think it's just important to be able to have those conversations. And then I think that to your last question, is there some kind of help to find out what stage you're in? I know that there is really improved imaging technology that now they can actually see either through like an MRI or even a CT scan, and even just like the other one, the topical, what's it called? Uh, I forget the name, but like there are scans that can produce great images that they can actually tell, okay, this looks like it is at this stage. But for the gold standard for diagnosis and staging is always a laparoscopic surgery. But if you're seeing a specialized someone who understands endometriosis, someone who has a track record of treating women with endometriosis, I think that's a good start.
Okay. Elizabeth, do you have something to say?
Okay. So I'll share a few information. She asked that at what point do you recommend surgery? I think that's upon the gynecologist because maybe someone may be in stage 2 or 3, but they're experiencing so much pain. So the how much intense the pain is, and depending on the mass of the endometrium cells, it really uh, communicates or shares when someone needs to have a surgery. And is there some kind of how to find out at what stage we are in? Yes, laparoscopy is done, and that will help understand by just observing. Because for stage 1, you realize that endometrium cells are very small and few. But for stage 4, that's when the endometrium cells are so many to a point that they can make your body organs to like fuse together, which can be so much painful. So when you do a laparoscopy, it would help in finding out what stage you are in, and then the doctor is able to tell. But generally, the gynecologist will tell you much about it.
Okay, thank you both for sharing. And I'm seeing Deborah has a follow-up question. So Elsie and Wahito and Liz, I would just request that as I read through the question, you can also check in the chat because it's a bit long so that we ensure that you comprehend the question well. But I'm going to read it out loud. So she's saying, also from what I've understood from the medical perspective is that endo creates this scar tissue that endo creates this scar tissue, what then causes the tissues to fuse in the organs of the abdomen? So, my follow-up question is that through surgery, new scars are created, and with every period, new menstrual blood brings new stem cells who create endo hotspots. This would mean the endo comes back no matter how often you do surgery. So, that is her follow-up question, and I'll bring it back to you, Wahito, Elsie, then Liz. Yeah.
That's a lot. And I don't know if this is just evidence of someone who is reading a lot and is well informed about the condition. Unfortunately, endometriosis is known to recur. I have gone through like my fourth surgery, which was about 5 years ago, 2020. I had an excision surgery with a great with a great endometriosis specialist. And because of also the multidisciplinary team that he brought on board to manage the pain, to manage the recurrence and everything like that, I am lucky that I am not experiencing any endometriosis pain so far. But it is told, and I have read that you can go 6 years after good surgery. After you just, by the way, you just need one good surgery. We don't need multiple recurring surgery. And the reason for the multiple recurring surgeries is because we know, in addition to what you have shared, is that we know that there are specialists who go in and do botched surgeries and just don't do a good job. And sometimes also endometriosis, just by touching like those pockets where endometriosis will sit, can trigger some endometriosis that has just been lying silent in there. And we can go into length about that, but I don't even want to take away from the main topic that we're speaking on right now. And what we could do, Lydia, is probably seek to host an endometriosis specialist in the next session so that they can answer from their perspective, from a clinical perspective, because remember, we are just lay people, but we are so empowered. And that's why we are able to try and bring you the correct answers, even if we ask you to also fact check us. So again, just always go to the doctor. But yes, endometriosis has chances of recurring. Sad truth.
Maybe just to add to what Elsie has said, yes, endometriosis has chances of recurring. I think most doctors, when you've talked about the new scar tissue appearing and then menstrual blood builds up again, most of the doctors, when you go for surgery, they try to remove as much of the endometriosis cells that are in your abdomen as possible, with as little scarring as possible. Of course, it depends with your body, and there are so many other factors that for us as non-doctors don't know. But most doctors try to ensure there's as little scar tissue as possible, and also that they remove as much endo tissue as they can, so that there's no right after surgery, there's not as much buildup of the old blood that starts happening in your abdomen, because they've tried to really remove that endo tissue. But what I'd also like to add is every surgery is different, because everybody is different, and how the endo has manifested in your body is different for everyone. But I think the doctors try to clear as much as they can, so that and try to give you a chance before there's any other there's a period of recurrence, to the best of their ability.
Mm.
And just to add on it, apart from it recurring, because remember, estrogen is a hormone. A hormone is not like maybe an organ. A hormone is not an organ, so it's invisible. So you might think you've removed all the hormones, but there's a hormone that's just still there. And then also you need to understand that as one develops into the period of menopause, because estrogen keeps reducing when we get to menopause, then you'll find that also the cells tend to reduce. So it also depends with the situation. Yeah, they can grow, the cells can grow again, because estrogen is not an organ, it's an hormone. So the hormone can also regenerate itself.
Okay. One last question from Deborah is that she's asking if there are any herbs that you can recommend.
Yeah, I think just very quickly, there are some foods and just herbs, of course. And all of this, I think, with medical supervision is what I would also recommend, right? Like see a nutritionist to try and help you understand, because like Lydia said, not all of us will respond. Our bodies will not respond to treatment the same way that, like, for example, mine will respond to Lydia's. But I know like turmeric, ginger, for example, omega-3 are really rich in anti-inflammatory properties. So I think that's one way to go. And I know that there was even a presentation that was done at this year's the COGS, the Kenya Obstetrician and Gynecological Society, a presentation by an Indian doctor who came to present, and I can send you a video link of that, Lydia, to share with the people who've registered, just to see that, these conversations are, from, people who are using these alternative treatments are actually coming into the rooms where we need to have these discussions, because we do know the burden of some of these hormone suppressants, especially at a young age, because endometriosis affects also a very young population. And therefore, I think that's why we need, and this is why research is important. That's why we need to continue to advocate. That's why we need to speak up and actually fight for non-hormone based treatments, right? And so I'm going to share that link so that you can listen to that doctor and hear what she had to share. And this is based off of years of research, just discovering that there's some herbs that can actually help manage. I'm not going to say cure. I hate using that term because I know there's no definitive cure for endometriosis, but there are herbs and there's some foods that can help reduce the inflammation and yeah, just the pain levels of endometriosis.
Okay, thank you, Elsie. Wahito, maybe there's some insights you might share on that.
I'll share in the group chat a post on some of the foods that can help with managing inflammation. I do know that there are some foods that can aggravate inflammation. Things like alcohol, things like wheat, they can aggravate inflammation. But there are also, I don't want to speak about them without a sure way of or sure information about it, but I'll share a post on possible foods in the group chat that will reduce inflammation, and possible supplements like magnesium that may aid in reducing inflammation, that may be helpful. And you can look at them. You can go read more about them. Let me just share.
Okay, thank you, Wahito. Just to ensure that we don't miss, I want to go to Emma, but before that, I can see Fleischer, I hope I've not butchered your name. She had asked if can one be diagnosed without laparoscopy? And I can see Elsie give her an answer, and she said, yes, you can. Remember, the more information you share and the specialist you see can actually diagnose endometriosis. So I just wanted to ensure that everyone has visibility on that. Then I'll go to Emma. Thank you, Aheto. The link has been shared on the chat, so you can pop your eyes on the chat. Emma is asking, how do you deal with stigma from your partner? It hurts always being told you're a drama queen. The pain makes me not even eat, and I feel all alone. Yeah, I want everyone to share. Elsie, Wahito, and Liz. We can start with you, Elsie.
Well, yeah. So what I forgot to share is that I was once married and I'm divorced, and it's not because of endometriosis, but I can talk about how important the partner support is. I think it was so critical for me. I think just to be told to be dismissed. I think when I said that I was in pain and I was ignored, and that killed me. I won't lie. And I still don't have strength to actually talk about it, because I know how important that is. And so maybe I'll hand over to Lydia because she had a lot of positive. I mean, I'm in awe of her story because again, like I say, she's the opposite of what I hear a lot of people are going through with their partners. So over to you, Lydia.
First of all, just like to say, really sorry, Emma, for the experience that you've had. No one deserves to go through something like that, especially it's not something you've chosen. And what everybody would like is to just receive the love and support they need when they're going through such a hard journey. What I would say is sometimes people do not understand when you say you're in pain, people think they equate their level of pain, maybe for a headache, to the level of pain you're experiencing. So what I would advise is if you have a gyna who's understanding and you can go with your partner and they can explain to them or take them through what endometriosis is and the kind of pain you experience. I know sometimes people may think because of the level of fatigue endo patients experience, people might misunderstand you and think, is this person lazy? She doesn't like to work, but you really do not have energy. Because I remember I used to wake up very, very tired. So if your partner can agree to just a therapy session where a good therapist who understands what endometriosis is and what people with endometriosis go through, they may be able to help articulate your experience, and they may be able to understand better what you're going through and help give you the support that you need. Additionally, if there are people around you that your partner respects and they do know and understand endometriosis and what endo patients go through, you can also reach out to them and just see whether they can be able to assist with talking to your partner, sharing what it is that people with endometriosis go through, the level of support that they need, so that they can be able to walk in your shoes and they can be able to understand that you're really going through it and you need all the love and you need all the support. So once again, Emma, I'm really sorry. I pray that you get all the support that you need. And remember, there's this community of women who are endo warriors. There's the group on Telegram by Elsie, by Endo Foundation of Kenya, where you can continue to get the support that you need and even the encouragement, even as you go through this process. Yeah.
Thank you, Wahito. I am seeing also there's another question. And this is regarding to recommendations. Felicia again is asking any recommendations on ways to help ease the lower back pain that comes with endo apart from painkillers. Elsie, I've seen you've answered in terms of like swimming and light physiotherapy works for you. But I can see still Felicia is sharing some sentiments on not being able to stand or sit for more than 20 minutes. So I'll still pose the question and back to you guys, and maybe you can share some of the things that have worked for you. Yeah.
Yeah, I think for me, when lower back pains prevail, again, this is another question to us as women. Why do we like pain so much? Like, see your doctor. And I know it feels like taking all these painkillers is a never-ending journey, but you need to give your body that relief. And I love, again, Dr. Charles Muteshi because he works with a multidisciplinary team. So he will bring in a pain specialist who will specifically come in to address your pain, right? So imagine with me, wait, I was going to pronounce something else. Your gynecologist might be there to address the endo disease, like the disease, and to actually, help you manage the condition, right? But there comes the multidisciplinary team is so important. So think about bringing a psychologist and a psychiatrist onto the panel, bringing a pain specialist who understands pain. And I know there's another friend of mine, she's an endo warrior as well, had to actually, then journey after her surgery, then journey with a pain specialist who then helped her at least control the pain. And again, like we're saying, I feel like we're getting into like now we need to give you guys clinical answers. We might not have the right responses. And I think like I'm again sharing and insisting, let us join the next session where we will have Dr. Charles Muteshi, and I promise you we will make sure that there is enough time for us to ask him the questions because he loves answering all your questions and seeing a lot of you girls get better. So I hope that helps. We might not provide you with all the right, we don't want to give you any misinformation as concerns clinical care. I think the objective of this session was to come and just highlight and speak on the mental health, like how you can cope from a mental health perspective, and also you're just managing your psychological symptoms. So yeah, see, and write to me. I'll send you like a chat right now privately for you to write to me.
Okay. Thank you.
Pleasure.
Thank you, Elsie. I know we are a bit over time, so I'll ask Wahito to speak to the aspect of like easing the lower back pain, and then we finalize with Elizabeth to speak on the same and to also answer the question on if stress magnifies the symptoms or the pains of endometriosis. So we can start with you, Wahito, then we close up with Elizabeth. Yeah, and I'm sure we'll have another session too. So I think next time we should have more time for the Q&A session. But yeah, amazing. Wahito, over to you.
I'd say the possible supplements that could help. For instance, I remember even because I used to record in my app. I've been using the Clue app for years, and I'd record the cramps. Today I'm having a lot of cramps, and one of the recommendations would be take magnesium. So, like magnesium is said to help with cramping. So that's one of the supplements that you can explore. But I've also shared a list on an Instagram post of possible other supplements that can help with different things. Because I know when you have endo, apart from the pain, you also have different issues that you're experiencing, like a gut and other things. So that post will be able to help you explore possible supplements that you can use.
Okay, Elizabeth, then we come to you, E.T. I can see your hand is up. So Liz, you're answering the question in case you have insights on the easing of the back pain and also if stress enhances the pain for endometriosis.
Yeah, it's true that stress can magnify the symptoms because stress is not only experienced psychologically but also physically. But also, there's something I felt like it's very important for us to know. I've had situations where a client diagnosed with endometriosis he becomes an addict to opioids. Opioids are substances that, okay, they are psychoactive substances, drugs of abuse, but they are specifically used for reducing pain. And what happens when you use opioids is that your body gets used to it. Once your body gets used to it, once you stop using the opioids, the pain tolerance increases. So how you're feeling the first time when you're experiencing the endometriosis, the next time without the medication, it's like thrice. So you find you get an addiction in the process of the treatment of whatever you're going through physically. And I felt it is very, very important for us to be aware, because some of the medication we get opioids, the painkillers. Be aware of what you're taking, so that at that moment where it is not given to you, the pain doesn't become worse. Because you see, for any drug of choice, you have to you need to increase the amount for you to experience the same feeling. So you can imagine you're trying to use as much medicine as you can, but it's not adding up. I felt like it's something very important to tell. And then let me get back to the question. Yes, just as I shared, stress comes psychologically and physically. When you're stressed, you even feel muscle pain. You lack sleep, your appetite goes down. You can imagine you're experiencing physical pain and you have stress, and then you're not getting sleep, your muscles are paining, you have an empty stomach, you feel like butterflies are moving around your stomach, you're sweating. So yeah, it can.
Thank you so much. Okay, I think allow me to proceed. Okay, yeah. Oh, I can see Winnie is also sharing the same. She's saying my lowest moments are when my students could always ask me, "Teacher, why are you crying?" or "You okay?" Yeah, I think this is a safe space, and I think it's good. Like, we join a community and we are able to share and talk to each other. It doesn't necessarily take away the pain, but it makes the load lighter on our shoulders. So yeah, just know that you have a community. We are going to be running these sessions all the time so that you can find an opportunity to speak, hear from another person, get encouraged, find resources that can help you and can be of help to you. So because I'm seeing we are over and above and beyond time, I'm just going to quickly share my screen so that I can be able to share any upcoming events that we may be having that can help you get just like a safe space for you to calm down. And we have gone ahead to look for communities that are in wellness, so that you're in just this space, safe space to just have some time to yourself and engage in wellness activities, and mentally get assistance, or physically some light low impact workouts. So because of time, I'll just quickly rush through them. So we will be having a walk in on 8th November by Serenity Social Club. I'm the founder, and what Serenity Social Club is about is we host digital detox experiences. It's ideally an 8-hour day without your phone, and then you come and spend time doing your hobbies, and also engaging with other people. So hobbies could be reading and really just finding time to yourself, resting and pausing, no distractions. Sometimes we also have kids, and sometimes you think that taking care of kids is rest, but it's really not rest. So Serenity Social Club really advocates for personal time, pausing, resting. You can just come and spread your Masai shuka on the garden and just nap 2 hours, 3 hours, whatever you choose to do. So we have diversified in terms of the events we have. So we're gonna have a low impact walk in Karura. It's usually 10 kilometers. And then on 15th November, we have Echoes of Hope, finding hope in the endometriosis journey for patients and their families. This will be our second session, a follow-up this 15th November. So please again join. And then on the 29th by Serenity, we're gonna have like the main event for disconnecting, the digital detox. Again, we have shared the links for the events on the slide. You can check them out. Then again, on the 6th of December, we have an event by Lost State of Mind. And it's again on 6th December. You can just watch out and look out for that. I'll just drop in the links to the pages and you can be able to follow them. But in the meantime, if you quickly have your phone right now, you can just scan the QR code on the screen to be able to follow our page, Echoes of Hope, such that in case you missed the Telegram link, you can quickly just DM us and we'll be happy to respond to you. If there's a link you missed, if you want to get assistance or recommendations on foods, fruits that you can take. If you have any question, Waheto is behind the screen, behind the social media page, so you can just get quick support in case you have missed out on something. I know it was too much to share, but in case you start processing the session slowly and you're like, oh my God, I didn't remember to take this link, just feel free to DM us. We are going to create a WhatsApp community so that we can be able to also share these resources and also be able to share like our upcoming session. And I will just give the mic back to Waheto to just give a small vote of thanks before we wrap it up. So Waheto, over to you.
I think for me, really grateful to this team that has made sure that this webinar is possible. Thank you to the team at Lost State of Mind, Sule, Vic, for choosing to be part of this project. Thank you so much, Elsie, for showing up, for your wealth of knowledge and just encouraging us, guiding us through this process. You have done a lot. I think God bless you for all that. Liz, for coming through with all the information that you've shared with each and every one of us, and just showing the challenges, the mental health challenges that we go through and how you can even deal with them. Wanjiro, for being the very good and able project manager and just helping managing the session. And thank you for showing up and just walking with us on this journey. And now, even through seeing you showing up, we know that this is not for granted. There's someone who's somewhere that's benefiting from this discussion. So thank you for coming through and for joining this webinar. And for all the people who've shown up, they probably just have people they know who have endo. They don't have endo themselves. Thank you for showing up. I don't know whether Elsie has anything else to add.
No, it was a pleasure.
Yeah.
It was a pleasure, real pleasure. Thank you for having me. And I'm really looking forward to more opportunities to collaborate to advance awareness about this condition and to hopefully improve the quality of life of many of the women and girls who are suffering. Thank you.
Thank you, Elsie. Liz?
I really want to appreciate us all for attending this session. And just a small reminder of whatever we do as Lost. We deal much, as much as we do art therapy and dance therapy, we really emphasize on your emotional well-being. And we work with your four emotions. That's happiness, sadness, fear, and anger. We help you regulate your emotions through activities like dance, art therapy, and we also have spaces for individual therapy sessions. So you can connect around with Sule and Vic. And in case you need therapy session, you can get help through that. Thank you so much for this time and opportunity.
Yeah, thank you so much. Sule, I'll just give you 0.11 second to just say something because I know you're part of Lost.
For me, I think I'll just say thank you very much. Let's keep doing this. Let's keep on creating awareness.
Definitely. Thank you all. This marks the end of our webinar. Thank you so much for staying. We are way above time, but this has really been insightful. This is not the first one and the last. We will have many more, and we will ensure that we have a community that is supportive of each other, both online and physically. So just make sure you follow our pages and you can reach out. Thank you all. Have a blessed night, and peace be with you all. Bye-bye.
Bye. Thank you.
Yeah.
Bye.